Okay, guys, in this module, we're going to be talking about division of work and how we kind of specialize and compartmentalize different areas of the healthcare sector that we may find ourselves working in. So everything that we do, like we said a couple modules ago, everything we do, every task, every activity you undertake is going to relate back to your mission, vision, and values. And that's what we kind of need to keep at the forefront of every decision we need to, or every decision we find ourselves making. So two ways we can do this, job specialization, or how we divide up the work, and then departmentalization, and how we kind of create different departments within our organization. And these are ways really we're efficiently organizing an organization to really achieve the process in the best and most efficient manner possible. So when we talk about job specialization, the classic example that I can give you, think about the assembly line and Henry Ford. So we had workers whose each job was broken down into different specialties along the assembly line, and as a result, we learned how to do one specific job really, really well, which unfortunately on the back end made it easier to replace employees, because now we just had to replace one specialty versus one employee who does everything. They're a little bit more difficult to replace. So kind of, an example from history that we can pull off and kind of build off of in the late early 1800s. Believe it or not, nails were really expensive to make, and making nails were a really big deal. So people would even go as far as burning down their homes when they moved so that they could just collect the nails, because they were so expensive. So if we look at, the difference that specialization made in innovation, in terms of, our lives, and kind of progresses to where we're at now. Without specialization, when we're looking at how to make a nail, we had one worker who was not specialized but did all the tasks themselves, and they could make about 20 nails a day. So we were getting, if you employed 20 workers, we're getting about 400 nails a day. So when we move to specialization, we kind of break this process down and have one person working on one piece of the process. We automatically go to where we have 20 workers. Before we were having 20 workers make 400 nails a day. Now we have 20 workers making 100,000 nails a day, with, about one worker making about 5,000. And think back again too, what is our highest cost again? Is our labor and our employees and our staff. So just kind of an example to just show you the difference that specialization can make in terms of a process. So when we think about departmentalization, what I want you guys to do is just think about a patient entering a hospital or healthcare facility, and think about everything the patient goes through, how we care for a patient along the continuum. We're going to have a lot of people working within that process. So we have a patient that needs billing, we have a patient that needs labs, they need their room cleaned, their maintenance done on their rooms, whether it's they've got a leaky faucet or they have to change a light bulb. We have somebody, they need food, they need medicine, they need care. So we break these different tasks up into logical units or departments. So we have a billing department, we have environmental services, we have food and nutrition, we have pharmacy for medications. And if you think about the university structure, we have different departments within the university, right? So, we have our administration building, which houses, our HR, financial aid. We have each college, and each college has departments within that college. So just a way to break things up into logical units. When we talk about achieving departmentalization, we have a couple primary ways listed here on how we would go about achieving departmentalization. We can do it by function, whether we're looking at nursing unit, or lab, if we look at by the function that the individuals operate in, we may look at it by the process, or even the territory. So you may have a VP of the Northeast Territory of, this particular market sector. We can look by customer. So do we have outpatient, inpatient? Do we focus primarily on OBGYN services, family birth? We can look at it by time. So how do we run our hospital in terms of shifts? Or we can even look at it by product line. And I'm sure, you may be able to come up with more than what I have listed here, but these are the primary ones that I want you guys to be familiar with. Let me scroll back to this slide real quick. I'm not going to play it within this recording, but I want to encourage you guys to go out and watch this this slide on Cancer Center Clinic out of Houston, Texas. Really great overview of departmentalization. Now, when we come to hybrid departmentalization, you'll see this done every now and then, but I just want to caution you against caution you when you think about doing this, because it can, go awry. You can have social workers reporting to nursing, which may make sense because they do work hand in hand, and you want to, they need that free exchange of information. But it can create a little bit mistrust, especially if it goes awry. It may make you come off as a little bit incompetent. Your staff and your employees may think, what is going on? This person doesn't know what they're doing. So I want to encourage you to really think about hybrid departmentalization before you go through and do that. So I've listed an example here of how we would kind of go through identifying these individual units or departments within a new organization that we're starting up. And to just kind of demonstrate, you can't departmentalize the same way in each situation. So here we have this 90-bed SNF startup unit. SNF is a skilled nursing facility. But when you open, you're not going to have 90 people right off the bat to fill the beds. So your initial plan, you're going to start with 25, move to 60 by the end of the year, and then move it up to 90 following that. So you are, by law, you have to have an administration. So you have to have an administrator, you have to have a director of nursing, things like that. But your social services administration, at the very beginning, this may be covered by 1 or 2 people, and then when you start increasing your patient load, hire more on. Same with nursing, dietary. You're not going to want to staff for 90 people right away. You're going to want to staff for what level you're currently at. Guys, we're going to end here with circular organization chart. As always, if you have any questions, please let me know and we'll pick up next time. Thank you.